the CS who has just been dismissed and really bangled the process of internship in this country. And we are really having a backlog and suffering of our interns. We have interns who are doing 4 months after they were posted and actually inaugurated by the CS herself, but 4 months down the line, they have not been paid. And we are calling upon the Ministry of Health, now that we have new blood, that they can be able to ensure that we streamline internship. We have almost 2,000 other interns who do not know when they are going to go for their internship. And internship has been there for clinical officers since 1928. We cannot understand how this government will be the first government that cannot be able to harmoniously ensure that the internship process is going on smoothly. So we call upon the government, and especially those who have been tasked in the presidential task force, to ensure that we have a long-lasting solution on the matters of internship, and that solution must not involve reducing the pay for interns. Because when you are doing our internship, we are actually working, we are actually providing service to Kenyans, we are actually also generating revenue for the counties and the hospitals that we do work in. That our governments, both at the national level and the county governments, have decided, and with impunity, to subject our clinical officers to those contracts. I'm talking about the UHC contracts, and I think we have done the best we can as the union. We have gone to the Senate. We have got a report that recommended within 6 months everybody under UHC should be confirmed so that the exploitation stops. We have gone to a whole government approach through the Kericho Declaration, where the same was actually buttressed. But we were surprised when then we saw them being added 2 years with the same salary. And when I'm talking about the same salary, I'm talking about a clinician who is working in the same rota with another one on permanent and pensionable terms, working the same number of hours, the same environment, seeing the same patients, but at the end of the month, the one who has been labeled UHC receives half of the salary of what the one on PNP is receiving.
We are here and we've had this symposium with a theme touching on matters NCDs, which are the common disease conditions currently in this country. And the Western team, clinicians, have committed to work together with the health systems to manage NCDs, which has become a big burden in this region. We have also taken this opportunity today to launch the new career guidelines for clinical officers in Kenya, and we have our Director of Clinical Services who has just distributed the new copies to the 4 counties, and we are happy that the CEC Health from the 4 counties have accepted to implement, and we call upon all counties in Kenya to know that we currently have a new career guidelines for clinical officers and to implement in all their levels, in all the county public service boards.
That our demand is that interns must be posted as it has been the norm, and they be paid as it has been the norm. That to mean we have interns who have been posted for more than 4 years now, and they have not been paid. 4 months, and they have not been paid. We want them to be paid because they are staffing, and they are actually struggling. Some of them even feeding from patient food. So we don't want that to happen because they want to reserve their dignity to continue serving. Those interns constitute 27% of our healthcare staffing in all the public sector, specifically the referral facilities. And we want them to be treated like human beings, and the right priority in terms of utilization of our resources in the sector be put as such. The other issue is about the presidential task force that he put in place to look into the issues of the human resource. And we believe that this is intended to bring the reform that we want in the sector. As such, our request is we have other constitutional body like the SRC and the Public Service Commission that are supposed to inform in terms of how you do the rationalization of the public sector. For instance, the SRC, one of their mandates is to ensure harmonization of payment, to ensure that there is productivity in the sector, and to ensure there is equity and fairness. All those things, since we have had this body in place, it has not been able to live to their standard. We still have big variances in terms of what people are receiving, and they have never seen a sense to ensure that we can be able to look and make changes where necessary. I give a specific example, that today you still pay clinical officers, and a majority who are at job group H, a house allowance of 4,000. 4,000. And that is money that was given more than 20 years ago. Which house can these people live? So what we are calling for is a full reform that can consider issues that motivate the staff in the health sector so that they can be able to concentrate in the issues of the patient. Some of these issues, including the risk allowance, that the issues of the medical cover that is not comprehensive as it is dictated by the law. We feel that that is sabotage to the healthcare workers, and we want to recall the government to ensure that they are reconsidering their position. A majority of our workers do not have a medical cover, and that sabotages them to mental anguish and the anxiety they have. So we are calling on the government to ensure that they focus to ensure that they are supporting the clinical officers and the healthcare staff to ensure that we can keep the focus on the UHC. Because the UHC has been a song that we have been singing several years now. It was launched more than 3 times by the previous government, and now this government also launched it last year. We are now clicking 1 year since it was launched in Kericho, and we see no action into it. And that then speaks to the situation that we had a CS who could not deliver, and we have another one coming in. Whether they are able to deliver is another issue, because we do not know where she's coming from, whether she is even oriented in terms of the key agenda of the government, we do not know. But we want to give her full support if she can only focus to be actionable.
UHC is a good program, and it needs to be implemented fully. And at this point, I want to urge the President and the Minister of Health to actually make sure that the objectives of UHC have been met. And back to the counties, and Kakamega County especially, through the Minister of Health, Dr. Bernard Wesonga, I'd like also to request you to look into the issues of clinical officers in this county, and the rest of the county also to look into the issues of clinical officer, because this has been ongoing for a very long time. So we expect at least to get good results out of this symposium, and also to get results from the national government, both from the national government and the county government.